If your bowel movement is less than 3 times per week, or when stool is hard, dry, painful to pass, or requires training, it is called constipation. Constipation affects around 20% of population. It's 3 times more common in women. Almost half of people with constipation use laxatives. For them, it's difficult to have bowel movement. This causes dependency and worsens intestinal motility. On the other hand, almost 70% of people with chronic constipation develop hemorrhoids. This causes straining and tears in the anal area, leading to pain and bleeding. Some people even need hospitalization due to fecal impaction and bowel obstruction. Constipation is also strongly linked to colorectal cancer. People with chronic constipation have 2 times higher risk of developing colorectal cancer. That's why I will tell you top 10 most effective natural ways that help reduce and treat constipation effectively. The first step when a person has constipation is to add dietary fiber to the diet. There are 2 types of fiber. Soluble fiber, like oat, chia seeds, and fruits. They absorb water and form gel, which softens the stool. And the second type is insoluble fiber, like whole grains and vegetables. They add bulk and speed up bowel movement. According to meta-analysis, 77% of people who have chronic constipation and start to take fiber improve their condition. Recommended intake is around 35 grams of fiber per day. Increase the intake gradually to reduce gas and bloating risks. The first and most evidence-based food for constipation is prunes. Prunes contain soluble fiber plus sorbitol, which is natural laxative. Best daily intake is around 5 to 6 prunes per day in the morning or in the evening. It improves stool frequency by around 2 times or 200%. The second most important food is chia seed. Chia seeds contain both soluble and insoluble fiber. They have around 10 grams of fiber in 2 tablespoons. Best daily regimen is 1 tablespoon soaked in water daily. It improves gut motility within 2 to 3 days. And flaxseeds. Flaxseeds considered also very effective. They contain soluble fiber. Best daily intake is 1 tablespoon of ground flaxseed with water or yogurt daily. Randomized studies show that it softens stool and has laxative effect. The fourth most important food is oats. Oats contain soluble fiber called beta-glucan. 1 cup for breakfast is considered the best regimen. It adds bulk and improves colon transit time. And kiwi is also important fruit. It contains soluble fiber plus actinidine, which is enzyme, and it helps also constipation. Taking it daily on empty stomach improves bowel movement around 80% of cases. And apples with peel also help. They contain both soluble and insoluble fiber, and 1 to 2 apples per day improves stool formation and constipation noticeable. The second important step to treat constipation is exercise. Daily exercise around 30 minutes per day at moderate pace, around 4 to 5 kilometers per hour, improves constipation significantly. Also, yoga and core exercises like plank improve natural abdominal pressure and support defecation mechanisms. And best plank practice is to hold it for around 60 seconds. Other exercises like biking, swimming, dancing, and other activities also improve bowel movements. The third way is to intake natural osmotic agents such as magnesium citrate or magnesium oxide. The optimal dosage is 400 milligrams per day. It pulls water into intestines, softens stools, and triggers bowel movements. Effects usually start within 6 to 12 hours after intake. Another solution is prune juice, around 200 milligrams per day. It works slower, but it's effective because it contains sorbitol and soluble fiber. And pears, especially ripe pears. 1 medium pear daily are rich in sorbitol and fiber that helps stool passage naturally. The fourth step is to establish a regular toilet routine and proper position. Best time for toilet is usually after breakfast because of gastrocolic reflex, which naturally stimulates the colon after a meal. Footstool and light squat position straightens the rectal angle, making it easier to pass stool. This simple but important trick, using a stool under the feet, improves bowel movement in 70% of people. The idea is that footstool is to elevate the knee above the hip. And fifth step is to add probiotics into your diet. Probiotics help restore gut bacteria balance, improve intestinal transit, and reduce bloating. The meta-analysis in 2017 in the American Journal of Clinical Nutrition found that probiotics increase stool frequency in 77% of people with constipation, especially Bifidobacterium lactis and Lactobacillus casei were among the most effective strains. Best option is yogurt or kefir, 1 cup daily, supplements with Bifidobacterium lactis or Lactobacillus rhamnosus in doses of 1 to 10 billion colony-forming units daily are also effective. Probiotics effect is usually seen in 1 to 2 weeks, and the best time of intake is with meals or right after meals. Taking probiotics with food helps them survive stomach acid and rich gut. It's also best to intake them at the same time each day. For yogurt and kefir, morning and evening is both fine, depending on your routine. For supplements, after breakfast or dinner is common and effective way. And sixth step is to be cautious with medications, because 30% of constipation is caused by medications, especially iron supplements. They draw water out and can irritate bowel. In this case, the solution is to switch to a low dose or take it in liquid form or add fiber and stool softeners. Also, calcium channel blockers like amlodipine, verapamil or diltiazem, they can relax bowel muscles and cause constipation. And tricyclic antidepressants like amitriptyline and nortriptyline also cause constipation. Newer antidepressants like serotonin reuptake inhibitors may be better choice in this case. Also, antacids with aluminum and calcium can cause constipation, and antihistamines like diphenhydramine and hydroxyzine, they have anticholinergic effects. In this case, the solution is to use newer antihistamines like loratadine and cetirizine. Other medications also can cause constipation, like Parkinson's disease medications and antiepileptics. And seventh important step is abdominal massage and pelvic floor exercises. There are studies showing that daily abdominal massage improves bowel frequency and stool consistency in 60% of patients. The massage is done as a clockwise abdominal massage around 10 minutes every morning, and pelvic exercises also help to learn how to relax pelvic muscle floor during bowel movement instead of straining. And now let's say top 3 medications and supplements which are effective and safe for long term for people who still suffer from constipation despite the steps above. Polyethylene glycol is the first option. It is an osmotic laxative. It is used daily for mild to moderate constipation. It is considered excellent for long-term use by safety. It is non-absorbable and non-addictive. The second is psyllium husk. It is bulk-forming fiber for daily use with water to support stool regularity. It is natural, safe, and improves constipation and cholesterol also. And magnesium citrate is another osmotic laxative for occasional use, 2 to 3 times per week or low doses every day. It's considered safe, but you should avoid it in case of kidney problems or kidney failure.